What if I told you that somewhere in a hospital, right now, doctors are pulling cells out of a dying patient, reprogramming them like tiny machines and putting them back in as a drug that is actually alive, not a pill, not a chemical, a medicine that hunts, that multiplies, that learns your enemy's face and stands guard inside your body for years. This isn't science fiction. It's happening right now. And it's quietly rewriting everything we thought we knew about beating cancer. Welcome back to What If. Today we're stepping inside one of the most extraordinary revolutions in the history of medicine, the moment humanity stopped trying to kill cancer from the outside and started teaching the body to destroy it from within. So for almost 100 years, our war on cancer had exactly 3 weapons. We could cut it out with surgery, burn it with radiation, or poison it with chemotherapy, and basically pray the poison killed the tumor before it killed the patient. Blunt instruments. All of them. A sledgehammer swung at something microscopic. They worked sometimes, but they couldn't tell a cancer cell from a healthy one. Not really. So the cure itself became a kind of controlled catastrophe. But what if instead of bringing in a weapon from the outside, you could turn the patient's own body into the weapon? Because here's the thing. Your immune system is already the most sophisticated defense network ever built. Billions of cells patrolling your bloodstream every single second, hunting for anything that doesn't belong. The problem is, cancer is you. It's your own cells gone rogue, and your immune system, brilliant as it is, often just walks right past it. The enemy is wearing a friendly uniform, so scientists asked a dangerous, beautiful question. What if we could hand the immune system a photograph of the enemy and teach it exactly who to hunt? That question became CAR-T. Here's how it works. And stay with me, because this part is genuinely wild. Doctors draw blood from the patient and pull out their T cells, the assassins of the immune system. Then, in a lab, they rewrite those cells' genetic instructions and install a brand new sensor on the surface called a chimeric antigen receptor, a CAR. Think of it as target lock. That sensor is tuned to recognize one specific marker, a protein sitting on the surface of the cancer, and almost nowhere else. Then those upgraded cells are grown into an army of millions and poured back into the patient. And here's the part that still gives scientists chills. The moment those cells find their target, they don't just attack. They multiply. One dose becomes a living, growing population that expands, hunts, and remembers. A single infusion that keeps working for months, sometimes years. One doctor described it perfectly, and I keep coming back to this framing. A painkiller is the same pill for everyone. But this is a medicine built from one single human being. For one single human being. It takes weeks to manufacture because every dose is one of a kind. For a long time, this was just a theory. Then the results started coming in, and they were almost impossible to believe. Like genuinely hard to process. Take multiple myeloma, a cancer of the blood that for decades always came back. There's now a CAR-T therapy for it that has become the best-selling cell therapy on Earth, roughly $2 billion in a single year. And not because of marketing, because it works. But the researchers weren't satisfied. They asked another what if. What if we don't wait for the cancer to fully form? What if we strike while the immune system is still strong before the disease has even declared war? So they ran a trial. They took 20 people who weren't sick yet, but who carried a roughly 50-50 chance of developing full-blown cancer. No chemo first. No preparation. Just one shot of engineered cells. One and done. And essentially, every single patient became what doctors call disease negative. No detectable cancer. None. a year and a half later, some past 2 years, still clean. Read that again. They may have stopped a cancer before it ever truly began. Then there's lymphoma. For patients whose aggressive lymphoma comes roaring back within a year of chemo, a rapid relapse, which used to be close to a death sentence CAR-T, now offers something almost unheard of. A real, proven chance at long-term survival. The trials showed it in black and white. Patients simply live longer. And it keeps getting safer, which, honestly, is maybe the part of this story that doesn't get enough attention. In the early days, the side effects were terrifying. Today, the dangerous reactions have dropped to low single digits, so low that some hospitals now give these therapies on an outpatient basis. You could, in theory, drive yourself home afterward. And this revolution is not staying locked inside a handful of elite Western hospitals. In Pakistan, military doctors, after years of research, performed their country's first ever CAR-T therapy on a 21-year-old patient. The result? Full recovery. A young life handed back. One more nation joining a club that, a decade ago, barely existed. But here's where it gets wild. Really wild. Because everything I've described so far works mostly on cancers of the blood. The holy grail, the thing that would change everything, is solid tumors. The lumps, breast, lung, ovarian, the cancers that kill the most people on the planet. And the walls are finally starting to crack. At one cancer center, scientists built a next-generation CAR-T aimed at ovarian cancer. They tuned it to recognize a protein called MUC16, and then they did something clever. They armored those cells, engineering them to release a signal called IL-18, a chemical war drum that rallies the rest of the immune system right at the tumor and nowhere else. They even inject the cells straight into the abdomen to hunt the cancer where it actually lives. CAR-T transformed blood cancer, one researcher said. Now we're trying to bring that same miracle to the tumors that have always won. And then there's the logistics problem. Because here's the thing nobody really talks about. Every dose has to be built from scratch, weeks of work, enormously expensive, out of reach for most of the world. So what if you didn't build the cells in a lab at all? What if you could inject something and let the body build its own CAR-T cells inside itself? That's called In-Vivo CAR-T, and the first human results have just arrived. In one early trial, at the higher dose, every single patient responded. 100%, and most had no detectable cancer left on their scans. This new design also outsmarted an old enemy escape. Cancer is cunning. I mean, genuinely cunning. Aim at one marker, and the tumor can simply stop wearing it and slip away invisible. So this therapy locks onto two markers at once, making it far, far harder for the cancer to disguise itself. Hit it from two directions, and there's nowhere left to hide. And behind all of it, a quieter tool is reshaping the entire field. Gene editing. Using CRISPR, scientists are now scanning living immune cells, searching for hidden switches, genes they can flip off to make these cells expand harder, dig deeper into tumors, and fight for longer. We are, in other words, learning to upgrade the human immune system on demand. And this is the bigger story, the one that ties it all together. Because CAR-T is just one soldier in a much larger uprising, the immunotherapy revolution. The same core idea, don't attack the cancer yourself, teach the immune system to do it, is now powering a whole new generation of cancer vaccines. And I know how that sounds. Not vaccines to prevent an infection, but vaccines that show your body a mugshot of your own tumor and order it to attack. Order. For a century, the word vaccine meant prevention. Now it might mean cure. The line between treatment and immunity is dissolving right in front of us. But look, let's be honest with each other. This isn't magic, and it isn't free of danger. When you unleash an army of activated immune cells, the body reacts hard. There's a storm called cytokine release syndrome, a raging fever as the immune system floors the accelerator. And more frightening still, the brain can be affected, confusion, tremors, sometimes a temporary facial droop. For most patients, these fade away, but they're real and they're serious. So how do you tame something this powerful? With another new revolution. Researchers fed the records of nearly 400 CAR-T patients into a machine learning system and taught it to predict which patients are about to develop dangerous neurological side effects before it happens. Artificial intelligence standing guard over a living medicine. Two of the biggest revolutions of our age working side by side. And then there's the part of this story that almost nobody talks about. The part that, honestly, made me stop and just sit with it for a minute. Because when you cure a young person of a cancer that should have killed them, you don't just save a life. You hand them back a future. And a future means the ordinary, miraculous things. Falling in love, growing old, having children. Doctors across Europe recently went looking and found something extraordinary. 24 pregnancies in patients who had received CAR-T therapy. 18 babies born healthy, including a set of twins. Children who exist today because their parents' own reprogrammed cells beat back a disease that a generation ago would have ended the story right there. Think about that for a second. Not just survival, new life downstream of a cure. So what if? What if the future of medicine isn't a stronger poison or a sharper blade, but a partnership with the intelligence already living inside us? We're not there yet. And I want to be clear about that. These therapies are still expensive, still risky, still out of reach for far too many people. Solid tumors are still fighting back hard. And every triumph you heard today comes wrapped in caution. Small trials, early data, years of follow-up still to come. But the direction is unmistakable. For the first time in human history, we're not just fighting disease. We're teaching the body to fight for itself and then stepping out of the way. The living drug is here, and it is only just getting started. If this story amazed you, the way it amazed me, stay curious. Because the next chapter of medicine won't be written in a chemistry lab. It's going to be written inside you.